Universal precautions. Participants will learn about universal precautions to protect their health and safety in the workplace and minimize the spread of infectious diseases. Participants will learn specific safety measures for minimizing exposure and about the use of personal protective equipment. After completing this training, you'll be able to properly identify body and blood fluid exposure risk, to properly and consistently utilize engineering controls and personal protective equipment, policies and procedures to minimize the risk of exposure, and be able to understand and comply with reporting procedures and policies in the event of an exposure incident. Universal precautions are the techniques that people use to reduce the risk of transmitting infectious diseases. Basically, universal precautions are a standard set of guidelines aimed at preventing the transmission of bloodborne pathogens from exposure and other potentially infectious materials. Universal precautions were introduced in 1985 by the Center for Disease Control, mainly in response to the human immunodeficiency virus epidemic after it became clear that HIV spread through the exposure of blood and certain other bodily fluids. In the early 1990s, Occupational Safety Health Administration began to mandate the usage of universal precautions as a form of infection control. Based on research, bloodborne pathogens are microorganisms such as bacteria or viruses that are carried in the blood and cause disease in individuals. There are many types of bloodborne pathogens, including but not limited to syphilis, malaria, hepatitis B, hepatitis C, and human immunodeficiency virus. HIV is a virus that attacks the immune system. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or sharing of needles. If left untreated, HIV can lead to the disease, AIDS, acquired immunodeficiency syndrome. There is no vaccine for HIV, and there is no cure for AIDS. However, you can protect yourself by reducing your contact with contaminated blood or other bodily fluids. Hepatitis B is a bloodborne virus with an unpredictable course of illness and symptoms. Healthcare workers are 20 times more likely than the general public to contract hepatitis B through occupational exposure. Transmission can occur from needle sticks through sexual contact and from any surface contaminated with infected blood. The virus is not spread through casual contact. Hepatitis B can be prevented by getting a vaccine soon after coming into contact with the virus. Bloodborne pathogens are often transmitted through accidental exposure, contact between mucous membranes or broken skin and infected bodily fluids, and cuts with contaminated sharp items. Research shows that there are three main types of organisms that can cause airborne diseases, to include viruses, bacteria, and fungi. Airborne pathogens and viruses are released into the air as small particles by air currents. This is called airborne germ transmission. Airborne infections spread when bacteria or viruses travel on dust particles or small respiratory droplets that become aerosolized when an infected person sneezes, sings, coughs, etc. Airborne diseases include but are not limited to the flu, chickenpox, measles, and tuberculosis. Tuberculosis is a bacteria that is transmitted through the air when a person who has an active lung disease sneezes, coughs, or laughs. Tuberculosis continues to be a public health concern worldwide. Universal precautions refer to the practice in the healthcare field of avoiding contact with individuals' bodily fluids by the means of wearing non-porous articles such as medical gloves, face shields, and goggles. The principle underlying universal precautions is that the blood and certain other bodily fluids of all recipients of healthcare services are to be considered potentially infected with human immunodeficiency virus, hepatitis B, and other bloodborne pathogens. Universal precautions are designed to reduce the risk and transmission of bloodborne pathogens and other bodily functions. The specific implementation of universal precautions varies from situation to situation. It is important to treat all spills in blood as if they are infected. Minimizing exposure through education, use of protective barriers, hand washing, and the cleaning of contaminated surfaces are essential. Wear personal protective equipment like gloves, goggles, and etc. as required by the situation. Please get your hepatitis B vaccination and use engineering controls. Engineering controls are environmental devices that reduce hazards and minimize employee exposure to body and blood fluids. This includes needleless devices, shielded needle devices, plastic capillary tubes, and sharp disposal containers. Proper work practice include no hand procedures and handling contaminated sharps. You should always use universal precautions when coming in contact with certain bodily fluids. Please remember, you should treat all bodily fluids as if they are infectious regardless of what you think you know about the person. A major preventative measure is hand washing. You should wet your hands with warm soapy water, scrub your hands together vigorously, making sure to clean under the fingernails and in between the fingers. It is recommended that you wash your hands for 10 to 15 seconds. You should dry your hands thoroughly with a clean paper towel. You should never use your bare hands to turn off faucets in restrooms, and you should use a paper towel to open the door. When you wash your hands properly, bacteria and viruses that you pick up from the environment are washed away. Washing your hands properly prevents the spread of pathogens, which could help you and others you come in contact with avoid illness. Wearing gloves is not a substitute for adequate hand hygiene. Please remember, after you remove your gloves, wash your hands for 15 seconds with an antiseptic soap and dry your hands completely. Protective equipment should be used according to your agency policy. Some examples of personal protective equipment are gloves, protective eyewear, masks and face shields, gowns and aprons. When using gloves, be sure to wash your hands before and after you use them. Gloves are a very effective protective measure. However, if not properly used, you can increase your rate of contamination. It is your responsibility to ensure that you are using your personal protective equipment correctly. Gloves should be changed each and every time you come in contact with a new person or activity if there is an exposure risk. When disposing of contaminated items, you should discard all contaminated needles or other sharp objects into appropriate containers. You should not share personal items such as towels or washcloths. You should dispose of all used items such as napkins, tissues, or other sanitizing cloths. You should treat items as infectious materials and dispose of them per your agency proposal policy. Biohazardous waste is separate at the point of use and should be placed in a garbage can lined with a red bag either labeled as biohazardous. If an exposure incident occurs at work, you should report the incident immediately. You should seek immediate evaluation from a medical professional. If you think that you or a client have been exposed to blood or other infectious fluids, you should immediately wash exposed skin, cuts, or needle injuries thoroughly with soapy water. If you have been splashed by potential infectious fluids around the eyes, nose, or mouth, you should immediately flush the area with water. Immediately report the incident to emergency medical services. When an area has been exposed, you should clean the environment with the appropriate disinfecting solution, or your agency may have another product that they require you use. Bleach will kill both the hepatitis B and HIV virus. In order to minimize the spreading of viruses to other areas, any equipment used should be cleaned and disinfected immediately.